Until the war in Ukraine, COVID-19 was the war at home here in the United States, one that dominated the news cycle and life in general for most of the last 26 months. This graph showing the decline in deaths since the last peak in February, where over 2,500 deaths on average were recorded per day, with concerns that a new wave could be on the horizon.
We are no longer in that fulminant acute phase. That does not mean that the pandemic is over. By no means is it over. We still are experiencing a global pandemic. When you talk about getting it to a level of control really is not when you have tens of thousands of hospitalizations and you have 1,000 or more, 2,000, 3,000 deaths. It's when you get those levels low enough that it really is not disrupting.
The United States now boasts 66.7% of the population fully vaccinated, or around 220 million people. Roughly a third of that number, or 20% of the entire population, has received a third booster shot, with a fourth booster now available to immunocompromised individuals and people over the age of 50. With overwhelming evidence that vaccines help prevent death and hospitalizations, even though breakthrough infections and death can still occur due to the emergence of new variants and waning immunity.
We're seeing variants that emerge every few months. We've had Alpha, Beta, Delta, Omicron, BA2, BA4, BA5. So it's very difficult to really get a strong classical herd immunity when you have immunity that wanes and a virus that in fact does not stay stable. And you have an anti-vax movement which prevents many of the people from getting vaccinated.
In a country where early missteps led to places like New York City peaking at 800 deaths per day, even as the lockdown sought to limit the carnage. Refrigerator trucks parked outside hospitals as morgues were overrun, adding fuel to the fire, growing misinformation, and the politicization of the pandemic.
The virus. They're working hard. Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true. It's going to disappear. One day, it's like a miracle. It will disappear.
But more than 2 years later, tourists have returned to cities. Restaurants are doing a roaring trade, while a judge in April struck down the federal government's nationwide mask mandate for public transit, a matter the Justice Department is appealing.
Everyone is aware and anxious to move on from the pandemic. Nobody more than us, I can assure you, would like to see the back end of this pandemic. But the reality is that you have a right. Everyone has a right to their own opinion as to whether this pandemic is over or not. But what you don't have is a right to the fact. And the fact is that this pandemic is still raging.
And as complacency sets in, so will rising case numbers and death. It's a country where everyone knows someone affected by COVID-19. There have been many funerals, many unexpected goodbyes, and the trauma of being a frontline worker in the face of overwhelming fatigue, grief, and despair. And as the country approaches the once incomprehensible figure of 1 million deaths, mitigation remains key at a time where pandemic fatigue and rising case numbers could bring cold comfort to those seeking to turn the page on this entire chapter. Sherman Bryceby's SABC News, New York.